Hi everybody, Marcus Simpson with SurgeryPRO, and I'm going to tell you today about a couple of great products called the Dvt Pro XL and the Dvt Pro Lt. I think XL, this is the extra large, this is the light one, LT. Okay, so on the table in front of me, I've got some stuff. I've got a couple of devices, a couple of different disposables, my cup of coffee, which is hidden, but I won't be far from it. So good. And I want to tell you a little bit about what these things can do. Predominantly, they're going to be used in orthopedic applications, but there's a few different doodads. All right, so this is a legacy product. It's made in the United States, in Texas. Phenomenal device. It's a solid state temperature compression therapy system. It treats pain, swelling, inflammation, edema, lymphedema, and prevents DVT, or blood clots, deep vein thrombosis. This is its newest cousin, made by the same company in Texas, and they're great, just great products. They are solid state, meaning that there's electronics inside that electronically manages temperature and pressure, and these are used in place of cold therapy products and in place of other compression products. So it's an all-in-one wrapped up product. Now, this device is about 18 pounds. This one is about 10 pounds. And this device, which I think this is working. You can get another sense here. You'll see the top-down view. We're getting really pretty cool here. We've got some cool toys. Anyway, you didn't need that. All right. Control panel, okay, filter around the outside, the tank opens up, and we fill it with distilled water, and it's got a line, this hose here, that has, this is connected to itself right now, but we've got an outgoing and incoming water line, that's these guys and this here, and then a compression line, okay? That is for joint compression and temperature management, for pain management and local inflammation management of the joint itself. There's another couple of ports on the back, so just to give you kind of a sense, those three lines, water, water, air, okay, so an outgoing water, incoming water, and then a compression line at the particular joint, power line, power on off, and there's a left and right here for foot or calf compression. That's for deep vein thrombosis. I've got a filter around the side, got a couple of buttons in front, pretty straightforward unit. Very, very sturdy and generally put on a bed stand or a table, etc. Used by huge numbers of people. Hundreds of thousands, now, probably in the low million now, have used this product recovering from surgery. It's a great, great system. Now, wanted just to go over a couple things. You might have, if you're coming to us or you've gotten this product, you might have been given a set of these. These are pretty sort of standard throughout the industry. It's a calf wrap. Imagine your foot is here, your leg is there, sorry, the rest of your body's here. So if this was my calf, it'd be like that, and then my hips would be up here. And I've got 3 chambers, okay? And those chambers inflate sequentially, and that's going to push blood back to my heart by increasing venous velocity or venous return by a rapid inflation of pressure within these chambers. I've got a couple of push pins here, so those go in here, and I've got a left and right. I might be using them both. I might be using one or the other, and that's my blood clot prevention strategy. Now, if I have gotten my disposable from the hospital, I may have something that looks like this. This is a double butterfly. I may have, that could be over my knee. I may have a wrap that's like this. This could be over my elbow or my foot. I could have a larger butterfly, a smaller butterfly. This is a smaller butterfly. And you get the idea. Basically, we're going to put this on the ankle, the foot, the knee, etc., and we've got a couple of lines that come out of it. It's going to compress, and it's going to run either heat or cold through, and temperature regulated for determined periods of time. And that's going to act as local compression and local temperature for pain management. Now, this is this is wrapped together, but it's pretty self-explanatory. This is a shoulder. Right now, it's a left shoulder. You can imagine this is coming, the lower strap would be coming underneath my arm, or it may be tacked to the front and the back if you've already got yours on, you're looking. Similar sort of a butterfly, very straightforward. There's a few different sizes, and it's great really, really helps people. So what are we talking about here? We're talking about non-pharmacologic management of post-soft tissue injury issues. So what happens after soft tissue injury? We get inflammation, we get pain. Inflammation and pain stop us from moving, stop us from ambulating, and they're going to cause us probably to sleep a little bit less deeply, and other things. So we've got non-steroidal anti-inflammatories, or NSAIDs, we've got opiates and opioids for managing pain, we've got anti-inflammatory meds, we've got creams, and we have great products that do it all non-chemically. Some inflammation is arguably good, but we've had great success. Many surgeons of different types have used these for many different types of patients with great success. People are healing faster, it's accelerating recovery, they're getting into physical therapy faster, covered by most insurance carriers. It really does work. This is another sort of example. I'm going to leave that closed for the visual, but the idea is that this is what you would call a circumferential wrap, and there's a treatment area that goes all the way around the knee. This would typically be a knee. The whole thing will compress, and it's pretty cool as well. It's a lot of material, but it can be very good for certain types of knee injuries. There are smaller wraps as well. It can be used on a wrist and so forth. And this is just one avenue. Obviously, I've got a couple power cords, so you can imagine it's powered, obviously, and I want to give you one more sort of visual here, and then I think we'll probably at some point do some live demos where you can actually see these things in action. This is the newest from us. It's called, again, the Dvt Pro Lt. Smaller unit, can be mounted on a bed rail, bedside, digital display. Very straightforward to use. Different programs can be applied. Very quiet, nice product, and same functions between the two, just a different package. So who would use these? Anybody going through just about any type of orthopedic procedure has found this to be helpful. Certain applications in bariatric and GYN surgery as well, but predominantly it's going to be knees, hips, shoulders, ankles. And did I get everybody? I think I did. Yeah, and elbow fractures in young people, pediatric elbows. Sometimes wrist fractures as well for patients that have very low tolerance of opioids. And the bottom line is that we're relying on non-chemical approaches to solve the things that we might have done with drugs, but we can have a better risk profile, less side effects like nausea, depression, vomiting, constipation, and so forth. And drug side effects, etc. And that's the bottom line. So if you like more information, check out the website SurgeryPRO.com. You can email us at info@SurgeryPRO. And yeah, if you've had these products, tell us about your experience. If you like the product anywhere in the country, we'd be happy to talk to you. If you want your physician to take a look at it, send them a link. And if you've got an upcoming surgery, a family member does, again, that's just about any shoulder, knee, hip, ankle surgery. Think about whether or not this would be helpful for you in your recovery. Thanks so much for watching. Bye-bye.